So when there is a late marriage or a late pregnancy, lot of complications in childbirth are happening. And after the childbirth as well, in the child as well, we are seeing lot of neurological issues. So how you suggest these genome or DNA test in terms of premarital or in terms of the childbirth or when they are conceiving the baby at that point of time? How do you suggest
It's
your field of
really an
expertise?
excellent question, Mr. Indranil, I should say, because nowadays we have rather there is a hormonal panel we give in our DNA testing, where in which we know whether a girl is prone for premature ovarian failure, because girls are getting married very late. They want to become very proficient in their profession.
Yes.
And then they go for babies.
Yes.
So profession cannot wait also, and baby is also very important. So what we generally suggest is either you get this done when you are 15 to 20, you get this test done for girls to know their hormonal level in DNA. And we also suggest, if you are having the premature ovarian failure risk in your DNA, either you get your child earlier, a baby earlier, or you store the eggs. You can store the eggs, and then whenever you want, you can have your baby. That is what the suggestions we can give. And that is what many people, there is a famous couple, I don't want to take their name. So they got married 10 years before, and they wanted to be proficient. He is a very famous film star from Hyderabad, and his wife is also into a big medical hospital family. So they got married 10 years before, and last year they had their first baby after 10 years. So she had stored her egg. So these are the advancement in the medical science, where people nowadays they are all profession and profession oriented. So this can be done. And of course there are other ways in which this DNA helps you. You will know about your PCOS issue, your leiomyoma, endometriosis, and hypothyroid. And during the menopause, you have osteoporosis during menopause. So lot of things have come day by day. Our test also is getting advanced, and we have lot many options to stay healthy and know your body better. So that's what.
And what do you suggest when there is a childbirth, but compromised childbirth? Then what kind of services you can provide to those parents?
If I'm not wrong, you mean to say if the child has some autism,
Yes.
or other
neurological issues.
So see, once the child is born, we can't do anything.
Yes.
So there are.
Is there any provision that if you during the pregnancy you can stop it, or you can suggest them that you should continue with it, or you should discontinue the pregnancy?
Basically we do genome sequencing, where
Yes.
we see the SNPs. We have more than 30,000 genes in our body.
Yes.
So we study the genome sequencing, that we see the single nucleotide polymorphism. That is genome sequencing. Suppose you want to know whether you have any issue of autism or any other issues, genetical issues, you should go for a exome sequencing, that is diagnostic DNA test.
And what is the right time for it? First trimester, second trimester, what is the right time to do these kind of tests as well?
See, this if you go to your gynecologist, and they will suggest you, I think it should be in the first trimester only you have to do this, and get better. We can prevent it that way. Then feel sorry later, like once
Yes,
that
that's
baby
why.
is born, it's a lifetime challenge for the parents also and for the kid also.
Yes.
So when
And it's completely changed the entire family dynamics.
Yes, science is helping us. We should, all the mothers, would-be mothers who are getting pregnant, they should go to the gynecologist and go for this diagnostic DNA test, so that the child, if you have any risk, and the doctor will suggest you the next way what to do.
Now I have 2-3 sets of questions. Number one, that when there is a normal pregnancy and at the right kind of age, then maximum families, they think that everything is fine, so go ahead with. number one.
Okay.
Number two, when there is a late kind of a pregnancy, means after marriage, 10 years after marriage, the pregnancy is there. So it's a very complicated maybe sometimes, or maybe sometimes a lot of extra care to be taken at that point of time.
Yes.
बट जब नॉर्मल कोई चीज़ होता है हमारे यहाँ पे हिंदुस्तान में, तब हम ये जो मेडिकल टेस्ट है हम एज्यूम कर लेते हैं कि सब कुछ सही है.
बराबर बराबर. हाँ.
बट ज़रूरी नहीं है कि सब कुछ नॉर्मली हो रहा है तो भी मेडिकली इंटरनली सब कुछ सही है. और जब हम ऐसे केसेस में देखते हैं कि जीनोम टेस्ट हो गया या डीएनए टेस्ट हो गया है, सबसे पहले जब भी किसी को सजेस्ट किया जाता है देयर इज ए इनहिबिशन कि क्या ज़रूरत है इसकी. डॉक्टर तो है ना, डॉक्टर तो बोल रहे हैं सब कुछ ओके है.
Correct. See, doctor is a god for everybody. What doctor says, the patient or the client or whatever, they follow. And your question is very correct. People who get naturally conceived and they are immediately after their marriage, they are very young and they might think they are perfect. But sometimes, what you call, nature gives a very different perspective. So. It's not that only for the old couples they might have issues when the child is born or the baby is born. It happens for the young couples also, and who are getting the child immediately after the marriage. So everything is God willing, 99% everything is normal. But the aged people who are getting married late and getting children, that is more challenging. But sometimes when you see a newly married and young couple also are finding sometimes they have this challenge in their childbirth. But
now my second set of question is the pricing of these kind of tests, because हिंदुस्तान एक बहुत बड़ा देश है और पॉपुलेशन हमारे यहाँ पे कोई प्रॉब्लम है नहीं, पॉपुलेशन की कोई कमी नहीं है. सो मैरिजेस हमारे यहाँ पे एक बहुत बड़ा सेक्टर है जो बिजनेस को भी ड्राइव करते हैं, इकोनॉमी को भी ड्राइव करते हैं. सो दैट काइंड ऑफ इंडस्ट्री द मैरिज एंड दिस कपल गिव्स अस इन द कंट्री लाइक इंडिया. लेकिन जब हम यहाँ पे कोई जीनोम या डीएनए टेस्ट की बात करते हैं, शादी में भले ही 20 लाख रुपए खर्चा हो जाता है किसी एक पर्टिकुलर चीज़ में, या खाने में ही 10 लाख रुपए खर्चा हो जाए, लेकिन एक छोटा सा टेस्ट करने के लिए हमको लगता है कि बहुत महंगा है और फिजूल की है, डॉक्टर जो बोल रहे हैं उसी में ही चले जाए. So how do you feel that these kind of tests should be mandatory rather than getting your kundali matched before marriage, or rather than even investing on something which is not that much required, but a child जब आप उनको एडमिशन के लिए बेस्ट ऑफ द बेस्ट स्कूल चुनना चाहते हैं जहाँ पे फीस होते हैं 1.5 लाख रुपए 2 लाख रुपए साल के, वहाँ पे ये टेस्ट की ज़रूरत हमको समझ में नहीं आता है. सो हाउ डू यू एड्रेस दिस काइंड ऑफ पॉपुलेशन to get the right kind of information through these kind of tests which can maintain for their lifelong with a healthy life?
See, when I was in my 30s, I had a very challenging health issue, and it might sound for others it's a very simple, but the person who has suffered will empathize with me. So that time I didn't mind 39-40,000 to spend, but I have got a permanent solution for myself. बट ये बात ठीक है, हिंदुस्तान में तो 1.5 लाख में 1,50,000 में तो मोबाइल फ़ोन्स खरीद लेते हैं, फिर फॉरेन हॉलीडेज़ में जाते हैं. मगर हेल्थ इज़ द लास्ट रिसोर्ट फॉर एनीबडी. एंड व्हेन दे से जब कुछ हेल्थ इश्यूज आएगा तभी देखा जाएगा, लाइक दैट दे आर taking it for granted. But if you see, we are spending lakhs in the hospitals. You spend so much, but you feel the depression or the trauma when somebody in the family is not well. That is more difficult to adjust or live that phase of life rather than to spend lakhs. Paisa to we can spend, but the difficulty, the challenge, the person who is suffering and the other family members, so that can be this will surely help to remove all those challenges. That's what.